Hi, my name is Gabby. I'm going to be the massage therapy student for today. Today we're going to be doing some palpation videos. The benefits of palpation is that it'll help me determine the resting state of a muscle, and it'll help me also determine if there's any abnormalities within the muscle. Some of the risks that I could reproduce pain or discomfort if there is any abnormalities present in the muscle. So for today, I decided to do a palpation video on the extensor carpi radialis longus muscle. So I'm just going to introduce it to you. I have two markers. I feel like with these videos, it's because of the lighting in my room and sometimes it's hard to see. I feel like markers do help with trailing and also identification of a muscle. Okay, so let's begin by introducing it. So the origin of the extensor carpi radialis longus is the supraepicondylar ridge, just like the brachioradialis. The insertion is the base of the second metacarpal, so right here. The action is extension and also radial deviation. And then as far as fibers go, the fibers generally just run horizontally here. It does run a little bit diagonally on the forearm just to reach the second metatarsal, but generally it's just horizontal fibers. So how are you going to landmark? So first you want to find your supraepicondylar ridge. So I will find my lateral epicondyle of the elbow joint, and then I'll just move up or proximally up to this little divot that happens in my humerus. That would be the supraepicondylar ridge here. So I'm just going to mark it with pink marker. And then as far as insertion goes, it's going to be the base of your second metatarsal. So when I extend my finger, you can see this tendon kind of popping up. I'm just going to follow that tendon just kind of to the base there. That's where you would find your extensor carpi radialis longus insertion. So the base of the second metacarpal, and it crosses the wrist joint. Okay, from here, how you would want to activate it, again, like I said previously, is that you would want to extend and then radially deviate. However, with these forearm muscles or any kind of small muscles, I actually find it more beneficial to use it without weight, since it does not take a lot of stimulation or resistance to make them pop out or act against resistance. So I'm just going to use gravity. So again, I'm going to go on my pink landmark here, so my supraepicondylar ridge. I'm going to extend and then radially deviate, and I'm going to determine the 4 T's of palpation. So tone, tenderness, temperature, and tone, tenderness, temperature, I'm missing one, tone, and texture. Sorry about that. Again, moving down, and then I'm going to periodically do this movement. I don't know if you can see on the video camera, but my fingers are just kind of popping up when that muscle is activated. Again, cross fiber palpate. I do have a lot of tenderness in my extensors. I do participate in a sport that does require a lot of fine hand movement and wrist movement. Temperature otherwise is normal. There is no high temperature in comparison to the adjacent muscles. It is a little bit ropey, and there's a little bit of hypertonicity there, so that would be that. So proximally up here, this is where a lot of the meaty part of the muscle will be. So here it's really easy to palpate when the muscle is activated. Once you run distally down, it's going to be a little bit harder just because it gets a little bit tendinous here, right? So you're going to really have to cross fiber palpate and activate the muscle to really feel that muscle pop up underneath your fingers. And then again, all the way to the insertion across the wrist joint to the base of the second metacarpal. And that would be the palpation for the extensor carpi radialis longus muscle.